Whew. All right. Good morning, everyone. How's everyone doing? Appreciate you all making it to a Saturday 8:30 talk about AI and technology. I know this is going to be the most exciting and sexy conversation for the day. So I'll try to keep it lighthearted and entertaining. But for those of you who don't know me, my name is Josh Lau. I'm with Nimble Systems. We're a healthcare records platform, relatively new to the space. Going to try to make this as least of a shameless plug for the company as I can and keep it more AI related. But going to use some real life examples that we're sort of seeing through our platform and, just in the broader acute care setting. So as we go through today's presentation, I do have time reserved at the end for Q&A, but please feel free to interrupt. This is also my first time presenting at ISS. I am not an ATP or PT by trade. Really, it was more on the business operations side, which was what led me to start the company. And we'll sort of get into details here on my background. But before we jump in, I do realize that is not today's date. So for those of you that are going to give me the rookie knockdown, I was expecting it. I'll get with marketing next time. So going through high level, I just wanted to lay out what we're going to cover today. Again, brief introduction about myself, my background, but especially the growing use of AI in healthcare, what we're seeing from a trend perspective in the acute care setting. Technology and the adoption of AI is actually the fastest growing tech adoption in all of healthcare at any point in time. I'm sure you all have noticed, healthcare in general is very slow to adopt. I mean, how long did it take us to get telehealth, realizing, they just extended some of the telehealth policies. But even then, I mean, that was only a few years ago. So we'll go into some very specific use cases and examples, both from front office, back office, and then from the clinical perspective. We'll sort of show you what we're seeing and where the capabilities are today and how they'll be advancing. But then really, what is our use case? What have we seen from a customer who has implemented some of these solutions, and how has it changed sort of their day-to-day? So background about Nimble. That is where we started, in that townhome. We had 11, 12 of us working out of there at one point. This was back in 2016. So we spent about 2 years developing. We launched in 2018, and really our goal and the need that we saw was just in general in the DME CRT industry, there was one, maybe two software providers in the space that weren't pushing or utilizing the latest technologies. And where we wanted to step in was wanting to leverage and be sort of the best tech provider as possible, collaborating with the industry and other practices to really help build a solution that is practical. So quick timeline. I'm a numbers guy, so gonna go throw some up here. But really, where are we at today as a company? We're billing through the platform probably 116 million every month. I'm not going to go over every detail up there, but we're implemented in over 330 different organizations across the country, working with some large nationals. Our focus has primarily been sort of the smaller, organizations, sub 5 million in revenue. But I just wanted to throw this up here as we've seen sort of a lot of different workflows, a lot of different organizations. And as we go through what we're building and how we're seeing AI being utilized, it's not a one size fits all. It is very, there's probably an 80, 90% of the time there is a general commonality that we're seeing. But the last 10, 15% that's really unique to your practice and your organization, that's where the real efficiencies are gained. And we'll go through that in greater detail here. But starting in 2018 till now, that's sort of our growth and track record, hitting our stride, and really just want to let you know that we're not, I guess we are a startup, but seeing some pretty good scale. So I wanted to take some stats from the AMA and just coming back from a recent larger acute care healthcare conference. Most healthcare systems now that I'm speaking with are utilizing AI in about 45% of their organization. And that's everywhere from intake to billing and clinical. So this stat specifically is more around, I would say, the clinical care side of things. But if you're looking at this, two-thirds of physicians now are utilizing AI. So I'm not sure when the last time you were with your primary care or, specialty provider, but a lot of them are leveraging this either sort of in the room with the patient outside, and it's catching on very quickly. I think one of the most important stats I wanted to point out here, sort of in that second bullet, at if you look at like where it was in 2023, 38% of physicians were utilizing AI. It almost doubled in the past year. So not only is the technology catching up, the mentality around it is the mentality around AI and how we can make that more efficient in the day to day is catching up as well. So I'm not sure if many of you all are thinking about this or utilizing it, but just wanted to show at least some of the numbers and where, broader healthcare is sort of looking at this from. So we decided to do our own survey. We were thinking, hey, if general practice is utilizing this, what is this? How does this translate into our industry, not just like CRT, but DME as a whole? And we'll go through the numbers and results as what we've seen, but pulled nearly 100 practice owners along with their admin team to answer a handful of questions. Really, we wanted to use this to help guide sort of our own internal roadmap of what focus areas our customers are trying to solve and what questions that they're trying to address. Um, and as we go through, what was presented to us, I think hopefully it's very common and it'll resonate with many of you here in the room. So on top of that, just, how are you all satisfied with technology today, with your current solutions, what you're seeing out there? And I'll go through just some alternatives, whether it's Nimble or other platforms for you all to look into, because I think there's just, from a tech side, I sort of nerd out about this. So would suggest you all take a look. But as we jump into where the real, I guess, meat of the survey was, it was the perceived value of AI. I think even from what I've realized talking with, owners today, admin teams today, there is some skepticism around AI. I totally understand that. And then for me, it really is showing the proof through the numbers and what we're seeing from an efficiency gain standpoint. So this was the question we asked. And essentially we, um, you know, asked respondents to sort of stack rank where or what problems that they were seeing. So all the way from sort of admin intake to patient intake, you can sort of see everything in between. But I would say overall, over 50% of every area of your organization, there was some interest in learning more or having more efficiency gains through technology. So today specifically, again, we'll go through front office, back office, and clinical, sort of like the bottom three questions there. But just from the standpoint of, how does our industry relate to the broader general practice, wanted to show common themes that other ATPs, providers, owners are thinking about and facing. Um, so going into patient intake, want to start focusing on our front office. Um, what technology lies in the front office? So what we're seeing, this was actually the first time I heard about the term. Again, relatively new to the ATP or CRT industry, but fax wranglers. I mean, granted, this is probably more at some larger organizations, but we saw a huge need from intake of referral coming in. So you have your fax cover sheet, your admin team is trying to get that in, trying to schedule the patient. They are also, welcoming those individuals walking through the door. So admin team is really slammed with a handful of tasks. And then not only that, trying to work on referral management and patient management. So this was one area of focus for us where going back to that survey and what we were trying to solve the administrative burden around sort of each role in the org, this was sort of a low lift, high return that we wanted to tackle. So if you can imagine, fax cover sheets coming in before you may have had to like sort of map out referral sources. If they changed their format or updated their logo, it could shift some things around. Data would get messy. But with where AI is today and the accuracy that it brings, all of this can be automated. So I wanted to go over sort of what solution that we're seeing, a quick live little snippet of our platform, and then how this impacted a business. So not only are we looking at sort of automating the patient intake um, process, there are, how do we now integrate that into patient reminders? How can we do insurance verification sort of automatically at intake? When we have a capped rental or if the patient's on anything recurring, can we get up in front of that and, sort of again, automate as much of that as possible. And, today, hopefully with your other systems or whatever systems that you are utilizing, this is something to look into or ask your rep. But not only that, on the intake side, taking it further. So after the patient's in the system, how can we sort of automate any intake forms? So sure, I mean, not only the HIPAA consent, but if there's any other responsibilities, waivers, things like that that you're giving the patient, how streamlined is that process? But ultimately, at the end of the day, how can we reduce that manual entry? So we'll go through a, again, specific use case at the end of the presentation, but we were able to automate the entire process with sort of our e-faxing solution. So it all starts at where we're seeing it at intake. And if we can, save 10 minutes per patient per entry, that was our goal. So as what not only is there a time savings, but from the manual data entry, right? We're not perfect. I'm not saying we trust the robots. We're not there yet, but it does reduce the error rate significantly. So whether you're miskeying, you know the patient's policy number, whether you're selecting the date of birth, these things happen, and we're actually seeing what the incidence rate is for that, where leveraging sort of this solution, we've been able to reduce that pretty significantly. So what does this look like from a practical standpoint? So this may look familiar. This is sort of our sample fax cover sheet that we're getting from, referral source A. And, we don't have anything fancy like ChatGPT where it shows it typing or anything like that. Literally, there was a click of a button, and tools out there already are able to help create that patient chart in your system if they don't exist. If they do exist, there is some logic to create that order and attach it to that chart. But if you could look at this, the insurance, the patient's insurance is automatically attached. We have documentation that we'll be able to send out sort of automatically once a new patient is entered, and this can be via text or email. But again, if depending on your volume and what you're looking like, what that looks like, even if it's 5, 6 patients a day, this can just save that one extra step for your front office team to focus their efforts elsewhere on more high value tasks. So just one example that we're seeing, I would say with your EMR, there's probably some preferred fax solutions out there that they should have integrations with to do something similar, or should be should be on the horizon here shortly. But this was, again, happy to save some time at the end of the presentation for Q&A and dig into some of this in greater detail. So circling back to the survey we polled and tying this all back into, where do we see AI and technology today in practices? We wanted to take a look at the coding and billing section. Now, some of you may be hoping for a magic bullet to help scrubbing and making sure that there's no denials. We're not there yet. We are working towards it. But this will be more, again, on that very first step of the sort of the admin paperwork chasing tasks. So the second challenge we saw was that, while we're seeing most EOBs and payments come back electronically, there's still a handful that are not or faxed in. And not only that, reconciling, when did you receive payment to when was the payment deposited in the bank, for your billing team members or even more of your like management team, manager or on your manager side. Huge issue that we're seeing. But again, if we're going on the same theme of sort of scanning and sort of automation, what we wanted to do was now take that, paper EOB coming in, create that payment sort of automatically for your billing team so that they can post. Again, dropping it into a potential like auto posting state or status, really just helps their time and again, efficiency. So what we're looking at is with the payment coming back from, insurance payer A, B, C, format may be slightly different. Again, taking the time to train or scan and like, what are the denial codes? What do they actually mean? What's a contractual write-off versus sequestration? All of this is pretty standard now, in terms of the actual denial code, but position on a if you can imagine the EOB coming in position on that form may be a little bit different. So we've been able to see other technologies out there, including ourselves, scan in your EOB, create that payment sort of automatically. So amounts, payer, who it is, if there are multiple patients because of patient IDs and how things like that exist, tag that sort of accurately, and without human intervention to search and find that individual or find that patient. So again, this was sort of that first step in helping us move towards that, you know easy button, I'll like to call it, of claim scrubbing, denial sort of, working denial management and working your denials, but taking the doing a proof of concept and moving towards the ability to more complex tasks. So again, starting simple and digging in deeper. But the impact that we saw from this, pretty straightforward. Billing team members that we were working with and collaborating, just even from the intake and just paperwork, purely paperwork side, able to save anywhere from 5 to 10% of their day to day on some of the just data entry side of this. So as we're continuing to go through the clinical documentation, and I'm not sure how many people here are ATPs or PTs. Maybe some of you stop by the booth. I see one, two, maybe. But really wanted to focus on the clinical documentation. So this is more in the sense of collaborating with the PTs and getting that LMN. So I'm not sure how many of you all here today are using some type of LMN builder, form builder, sort of eFax solution to the PT to get this documentation. The next step of this really is making the PT's lives easier so that they can get you the paperwork faster, quicker, better, easier, and just minimize that friction. So what we saw, again, I think this isn't just on the PT side, but across the board, our background, I think I skipped over it. We started in orthotics and prosthetics. So our practitioners, at the end of the evaluation are documenting their, interaction with the patient. But even on the PT side too, I mean, I've seen the Houston Methodist form. That thing is a monster. We have a reduced version of that for PTs that we've been able to use as a template to help generate a note. But what we're seeing is if we can make that time spent for them, if we were able to reduce that even 10, 15 minutes per patient, it's pretty significant. So what does that look like? Coming into this, I'm not sure how many of you have played with ChatGPT, Anthropic, or other tools out there. Let me get this up. But it's very interesting. I would say I use it almost daily. But when it comes to PHI and how you're leveraging it, I mean, technically, the just commercially available products out there aren't HIPAA compliant. So if you're looking at, training those models and if you're uploading any type of information, that is going into, like, let's just say their database more or less, where they are, keeping that info. With these providers, though, at least on the tech side, we have specific, I would say, integrations with them that, one, they don't store any patient information. Two, even from our end, we don't transmit any identifiable data, patient name, date of birth, address, anything like that. And as we're looking at training these models and working and making them more accurate, it's all de-identified. I mean, there are, you know, age and some demographic information, but this is how the systems are working today to make sure, we maintain privacy and keep that information sort of safe. So I know part of this talk was around compliance and sort of the ethical use of AI, and we'll get into that here sort of in the back half. But specifically with the LMN and note clinical note generation, we've been able to not only see this from, hey, fill out this PDF form or form and generate a clinical note. Maybe it's one of the manufacturer forms, and there's some additional content in there. That technology sort of exists today, but also if you are dictating and having your laptop, your phone up with the patient through that interaction, where you can be sort of more focused, more hands-on with the patient, that can also generate into a clinical note too. So we, different flavors on the sort of how care is given and how the interaction is with the patient, whether you're using templates on your laptop, speaking, there's technology that exists today to help leverage and make that and makes that more efficient. So from our standpoint, what does that actually look like? Again, bringing this back to the beginning of making the therapist's lives easier so you get your documentation quicker. For us, we're able to email a sort of one-time link to the PT. And through this process, some of you may have therapists that you're like, man, I know, Mr. Jones there, great at their notes. They may be on Epic, they may have their templates set up. You don't have to go back to them at all. You have a good working relationship. But maybe sometimes you have another provider you're working with that isn't the best. You're always having to track them down. They're always missing XYZ, component code in their documentation, where how this works in Nimble, and hopefully it's just getting the gears turning for how you're able to utilize this in your practice, or ask the questions for software providers to see what's out there. But after the ATP sort of does eval or creates or enters coding and product selection, we're actually able to send that alongside this portal to the PT. With that, if the PT or the therapist has their own notes that they've already written from their system that they want to upload, they can upload their note. We merge in the coding and product selection. They're able to select whether they want a SOAP note or summary on the therapy side, and it'll regenerate that note for them. So that's sort of the end result of what you're seeing here. And again, this is tying in the exact product, the needs of why the patient needs that tilt and recline, the adjustable armrest there, without the PTs having to sort of intervene even more. And this was sort of like just the first step of what we're seeing in helping that clinical relationship to help speed up that timeline, that length of care timeline for the patient. So there's quite a bit of info here that this demo doesn't show. But if you can imagine, right, here's a Houston Methodist, you're going through filling that out, or the PT's filling that out, I apologize. At the end of the day, they just click a button and it'll create that clinical note for them. So, in the acute care setting, this type of technology exists with just the dictation side and form side, but this could be used really for anything here. So, wanted to show some early capabilities there. So I guess I'll take a break quickly. Went over 3 topics. Any questions on what I just showed or anything else I can dig into? Yes, that was fast.
Thank you. So I'm a physical therapist, and I was obviously listening to your documentation thoughts there. Is there technology that allows for ambient listening during the
There
during
is?
the subjective portion.
Yes. Are you on WebPT or Epic or what do you use?
Epic in our
Epic?
clinic.
Yeah. So if you're using Epic and more in, I guess, an acute care setting, I would say there are tools out there available today, especially on the PT side. Um, I'm WebPT sort of like my go-to in that industry. If you actually go to their website, they have integration partners where they're specific around like PT vernacular terminology that even if it doesn't integrate directly into Epic, you could turn it on, listen, it'll be HIPAA compliant. You can copy and paste that almost over to your EMR on the note-taking side to save time. So I'm not sure that exactly answered your question, but ambient listening is all around there today. You can find, I mean, $100 a month on the clinical side that could save you, I don't know, 3-4 hours of what we're seeing.
So I think I think what I'm hearing is that there's companies that have so the PT templates aren't going to be wheelchair
Mhm.
evals are like
Yeah.
what 3% of what PTs do, maybe less. And so the main templates are going to be like a musculoskeletal eval
Mhm.
that things fit into. So like in Epic, we have a template we
Yeah.
use. And can ambient listening work with a wheelchair template? Can we self-create something that it then?
Yes. Yeah.
Okay.
So I've seen it in Epic where you have both, right? You have ambient listening. It creates, 80-90% of your note. You're reviewing it. You still have your hotkeys or templates that you can drop in between to merge it all into one. Now, if you're looking at this and working and how do you collaborate with ATPs better on sort of those edge cases or, the 3% that you're mentioning, you could still mirror the same thing, copy your note into a function like this, and it will merge product information, pull that in there for you to review as well.
Okay. Thank you.
Mhm. We are not the company that integrates with Epic. Yes. Yeah. Okay. Yeah.
What are some of the barriers that clinicians or providers who are wanting to implement this type of technology should be on the lookout for to help with the integration?
Great question. You're setting me up for the back half of this presentation. If I could hold that to the end and come back if I didn't answer it, I would love to do that. All right. Well, we'll still reserve some time at the end, but going to shift gears a little bit differently into the compliance sort of hurdles that organizations are running into and then use cases that we're seeing. Um, so if we're going back to the part of the slide that I introduced earlier, how are we seeing adoption increase or double in 1 year? And the hurdles that you were asking about, not only from the acute care setting, but all the way down to, a smaller practice, maybe 4 or 5 individuals working. There's a handful of factors that are or helping reduce that friction, but also speed up the adoption rate that we'll get into. So what are those? So from the technology side, I would say, even where AI was compared to 6, 12 months ago, it's made leaps and bounds. The founders of Anthropic, ChatGPT, and others, my software developers a little bit worried about this. They envision that 90% of the code for software will be written by AI in the next 6 to 12 months. So that's the speed at which it's iterating. And what we're seeing on our end, our developers today are using it to assist them in their coding. And this is why we're able to see such rapid developments, not only with AI, but with software in general. So that's one major side of the coin where, as the technology is getting better, it's getting quicker. It's kind of scary to think about too. If you're like my team members are like, man, like, does that mean 90% of us are going to be fired? No. We'll just be able to, just build quicker, better, faster. So with that, the workflow automation and integrations within your EMRs, I'm hoping that you're seeing that adoption or you, your organizations be able to implement that sort of successfully and quickly. So at the acute care side, there are a lot of consultants on the Epic, CERN, McKesson end that are looking at, proof of concepting this. It may not, I don't know how much it's being used in your day-to-day today, but I can almost guarantee that from the back end or from a pilot, there are quite a few things going on. But then with how the digitization of documentation, so whether something is coming in electronically or whether, you're scanning it in and turning it into an electronic format, just the capability of getting that into that state or that getting the data into that format is helping with these other sort of contributing factors beforehand. Um, so as far as back to the question on the barriers of entry and sort of concerns, I would say as of, we were working with a large national group that took almost like 8, 9 months to get over sort of AI compliance at a global level. But because of the efficiency gains that is out there that's being proven at a larger scale, legal groups and these organizations are really pushing this through fast, or the admin groups are really pushing this through faster, through legal, through compliance, whatever else to sort of identify. And there are sort of compliant standards now that are forming where, even 6 to 12 months ago you did not have. So I would say that's been one major barrier at some of the larger systems that we're seeing. But bringing this down to, smaller organizations, again, coming back to where tech is now compared to where it was even same time last year, integration points for us, for other vendors, everyone's working on something like this to bring into the system. You have all these point solutions, whether it's ambient listening, whether it's, some documentation, faxing, automation that is out there today. So on the documentation eFax side, there's groups, a couple of them all call out right now, Tenor, TENNR. Not sure if you've heard of that or heard of them. But really, they're able to take sort of that eFax solution that you saw, plug into your system, run eligibility checks. If there is any pre-auth needed, that process is automated and, they can integrate with most platforms today. That's one to look into. And then there's a couple others I'm happy to chat with after if there's any specific use cases people are looking at that we can jump in. But continuing challenges. So obviously there's a lot of benefits with AI, and sort of a motto that we have at Nimble is AI first, but not always AI. So there are specific use cases where most use cases that AI doesn't really make sense. And even going through, there is still human intervention today that is needed. Like there's still review that has to be done. The accuracy of it, I think we're like, maybe in the 80, 85% of where we need it to be. But then, not only that, there's a term in AI called hallucinations. And if you think about it, what does that mean, like in a data or science, like programming language? It'll just come up with something random that wasn't even related to your question, goal, or state. And those are still occurring, which is why we need that human sort of review. But those are becoming less and less frequent. So as you're testing and working through AI, it does learn, it gets better, it learns your preferences. But those are just some key hurdles to look out to sort of initially. Obviously, from the data security side, that's always there. From our standpoint, making sure, again, we de-identify that information properly. And when we are working with certain large language models, we know that they have those guardrails in place. One, just for that security, but also two, what other information are they integrating this with? Because if you're thinking about, on the therapy side versus cardiology, the end result is completely different. And if you're sort of using the wrong model, the output obviously will be sort of wildly different there. So I think I hit on these points without advancing the slide. But on the data privacy and accuracy and trust, those are two big points that we're really looking at. On the accuracy and trust part, again, I would say in the past 12 months, we've seen accuracy increase, I would say 30-40%, going from like 60s to like 80, 85. And if you're asking, well, how do we judge that, right? The way we judge that, we do have a transient listening AI transcription tool. So we use that. We had a practitioner on staff sort of work through, do their eval, do their note, sort of take their time and compared it to sort of AI and what that generated and what the gaps were, what it, missed or what it had incorrectly to help train and just work through and just make sure to see, where are we in that sort of advancement of technology there. But also going into the integration complexity, this is a hurdle that I would say is becoming less of a barrier. Most of your tech startups or tech platforms now that have come in the past, 3 to 5 years, there are integration points or something called APIs. Not sure if any of you have heard that term before or terminology, but essentially it's just the integration with, vendor to vendor. So that barrier to entry is significantly lower. Again, the standardization around, what does patient first name, last name, demographic, et cetera, look like, where we can pass this back and forth. All that is, coming into a more common format for technology groups like ourselves to be able to utilize and use. So maybe a little bit biased here, but how do EMRs sort of answer the question? And as you see all these new AI tools out there, I will say there's a million horizontal tools. And what I mean by horizontal, they're not really focused on a specific industry or vertical. They're more general practice, which is where the accuracy comes into play. So again, AI is only as good as the data it's being trained on. And if you're going super, super wide, getting that very detailed, that accurate note that you need, it's just going to take longer. So for very industry specific EMRs, I mean, around the therapies, around DME, I mean, you have Brightree, Nico, Bonafide, ourselves, trying to tie this back into the data or the nimble by the number slide I had up there earlier. You know, the only industry we're in is DME, working with CRT, OMP providers primarily. Having that, I guess, specific use case, that data, we're able to see what denials are coming through for what products, parts specifically. We're able to sort of outcompete the broader horizontal solutions. But even from the EMR perspective, you think about it, like the Epics, the Suners, the McKessons, right? I forget what stat it was. I think like Epic has like 60% of the US population's like health data or something like that. Pretty crazy to think about, but they're able to build on top of that and drive that efficiency. Scaling these solutions. So, I don't know if you're keeping up with sort of the market or the industry, but NVIDIA obviously just grew rapidly, right? Their cards are being used in most of these data centers to train. But not only having the data is one piece, but having the resources available to sort of scale up and tap into is sort of another limiting factor where, EMRs, I think, may be a little bit better positioned to not only integrate this in certain areas of the workflow, but also scale pretty quickly there. I think on the industry specific insights, tying that back to the very beginning of, the robust data lake, having, thousands of patients that are going through for the same group 3 powered wheelchair across the nation that we can dig into trends that we can build on, that we see ATP notes coming in, we see PT notes coming in to sort of corroborate that, just makes the platform even that much better. So going into a case study where we sort of implemented these 3 solutions into, not sure how this will resonate with many of you if you're in a much larger organization or care setting. May not be as relevant, but the numbers, I think, can just exponentially go up. So one of our clinic providers, awesome guy, allowed me to sort of show this up here. So when he took over the organization, I mean, they're probably like sub 1 million. They're close to like, 4.5, 5 now within 3 years. So they're growing pretty rapidly. And, with that, they did a combination of, complex, higher, CRT claims, where it's like 15, 16-ish, line items per code, but then also, if we're looking at repairs, supplies, etc., it was sort of a good mix of both. And, you know, looking at intake, billing, and then again on the clinical efficiency, what we were able to see, um, utilizing the tools that we launched. So on the intake side, whether it's our fax solution or just other fax solutions out there, it exists today. Just being able to speed up that intake, create that patient file without any intervention. We were able to see a 10-minute savings per patient for your admin team. And this is probably agnostic statistics. I do want to throw out there that with just even a lightweight integration and a tool, you can see these time savings in your org. On the AI side of this, we did have a transient listening AI note taker. So this summarized the interaction with the patient, and this also gave the transcript. Um, Typical evals that he was doing, I mean, lasting 40, 45 minutes, spending another 40, 45 documenting, hopefully after at night, early in the morning, for some of these more complex issues. Obviously, for these quicker, I would say, off-the-shelf repairs, maybe just follow-ups, 10, 15-minute type eval, same thing on the note-taking side. But we were able to see comparable time savings for, if you were spending 40 minutes in the room with the patient, 40 minutes documenting, that was reduced significantly there. And then on the billing side for his team, or our team, I should say, being able to just skip the creating a payment step and attaching the right patient to it, we were seeing about 15% savings there. And this was all, I would say, as of late last year. So these tools exist. They do move the needle meaningfully in the organization. So if you're just even thinking about, hey, if my role specifically is more focused around clinical, what does that look like? Clinician burnout, we're really hoping to reduce. I have a couple friends on the PT side who joined Nimble because they were sort of tired with the documentation and sort of with the provider side too. So if we're looking at it more from the admin, again, we're seeing some groups, hundreds, thousands of patients entered a day, where we can really help streamline, not us, but technology is able to help streamline that process. So with that, any questions? That is it. Thank you all.